It's Dr. Vincent Key, head team physician for the Kansas City Royals out here in now sunny Surprise, Arizona. Hopefully it's warming up a little bit. What we're going to talk about today is something that's been out there. It's a little bit controversial, but it's very relevant, especially to youth baseball players. And it's the concept of the weighted balls. With me today, Jeff Blum, our head athletic trainer. And Jeff, can you go over a little bit about the concept of the weighted ball?
The concept of the weighted ball is that you're using something that is either heavier or lighter than the baseball to help train your shoulder. The general concept actually started way back with the Olympics. The Russians started it out with doing under and overweight training, and most of the research that they found out was trying to keep it within 20% of what your competition object was that you were using. So for a baseball, if you were using that, then the general concept would be, you know, as a 5-ounce baseball, you use a 6-ounce or you use a 4-ounce. Well, newer studies have come out and there's been a whole bunch of talk. You know, there's Driveline Sports, there's other companies out there that are promoting using weighted balls, but, you know, from Glenn Fleissig and Mike Reinold and some studies that have come out with looking at the research of it, there's a lot of other factors that really start to play into it, because in these weighted ball programs, they're actually getting up to 2 and 4 pound balls, and not just staying within those boundaries. You know, the Russians always used the heavier weight first because they felt like you needed to have the strength before you really got into the overexcitation or the overspeed training, because they compared it a lot to like sprinting and stuff like that.
Right.
And so, you know, sprinting has the basic concepts. You have parachutes, you have things like that you train with.
Resistance stuff.
Or you can run downhill or run on a treadmill that's overspeed training. Well, the Fleissig and the Reinold stuff that's coming out is that the original thought was that if you used a heavier ball, it would be more stress on the elbow. If you use a lighter ball, it would be less stress. Well, what they found is that when using a lighter ball, it causes that higher peak stress, but it's a shorter amount of time.
Correct.
When you use a heavier ball, the peak stress is actually less, but it's over a longer period of time.
Because you're trying to decelerate the heavier object.
Yes. And so, you know, then my question back to you is, because of that, if you're using a heavier weighted ball, that causes you to then go into further external rotation. Or if you're using a lighter ball, that would tend to almost lead you into more internal rotation at the end. And we always talk about, you know, there's 2 main points of the throwing motion that are the problems. You know, when the guy's getting all the way back to max external rotation, or pretty much at ball release when you're coming through.
Right.
So what are some of the orthopedic issues that can happen? You know, and I'll start off with going into that max external rotation with an overweighted ball.
Right. So this is a 5-ounce ball, normal baseball, 5 ounces. This is a 7-ounce weighted ball. And when you're talking about getting into maximum external rotation, then you're talking about the shoulder, which is a ball in the socket, where the ball is going to be going forward as opposed to back. The other thing is as you're getting back to your external rotation, that you're putting more stress, what we call the valgus stress, onto the elbow. So as opposed to when you're going into internal rotation and what we call pronation, then you're putting more stress on the posterior aspect of your shoulder, and you're putting a lot of stress onto the bone, what's called the olecranon, because you're on ball release. So again, you're trying to slow down an object here, and you're putting more stress on the shoulder, what we call anteriorly, as well as on the ligament itself when you're going back into external rotation.
And that was kind of the issues that they saw with some of the studies that have been out there, that the younger kids that were using it, you know, there was a UCL, there was another kid that had to stop from like a forearm strain, and then there's, you know, some shoulder issues along with that.
Right. And it's not to the fact that they're using the object, but their bodies aren't ready to use the object.
Yes.
You have to get your body ready first to be able to withstand the rigors of some sort of weighted ball program.
And we were talking about this earlier a little bit. Why do you see an increase in velocity, or is there an increase in velocity with throwing by training with the weighted ball?
Right. And the thing is, it's intuitive. If you have something weighted and you throw it for a period of time and then you get a normal ball, yes, it's going to increase your velocity initially, but are you going to be able to sustain that for a long period of time, where you're going to need the strength of your shoulder and the strength of what's called the kinetic chain and the teaching of the tissue, whatnot, to be able to sustain that. And that's the problem, is that these kids aren't strong enough and they haven't trained themselves enough to be able to sustain it for a longer period of time.
And so, a lot of the velocity increase that you see is that it's that eccentric control of the internal rotators as they're going back. The studies that they looked at, the weighted ball throwing, there is not an increase in the external rotation strength of the shoulder.
Right.
And so that, talks about where the injuries are, because if you force external rotation, that puts your shoulder, especially if you don't have the control of that shoulder joint, it really puts you in a dangerous position.
Right.
The study from Reinhold, which was, was a smaller number of people, I think it was around 30 maybe, the average gain in external rotation that they saw with the guys that were using the weighted ball program was anywhere from 5 to 10 degrees. And this was a short program. Not a very long program. It's like 4 to 6 weeks.
Right.
So maybe talking a little bit about that physiologically, of gaining that much range of motion but not really having strength.
Right.
What's that do to the joint?
Well, that's what I'm saying. And in gaining that much range of motion, where's the joint going to go? Where's the head going to go? The head's going to go forward. Okay, so then you're putting your labrum at risk, which is your soft tissue ring around the socket, that you're forcing more of it, what's called a subluxation. You can also damage the structures in the front part of your shoulder, meaning your subscapularis and other structures in terms of that. So again, if you don't have, you can stretch out the tissue, but if you can't control it, then you're going to put other structures at risk.
Then another question, to bring up, so everybody is thinking about it. Kids will play, a spring season into a summer season. Well, okay, now we're going to go and get training, and we're going to do weighted balls during our fall and winter. And they're already fatigued. Does that really give them any time down from throwing?
Absolutely not. And so you start getting fatigue. And what happens with fatigue? You start recruiting other muscles, you start recruiting other things, and your risk of injuries go up. So that's the other part of that you have to have that downtime in terms of being able to withstand the season and to do it safely.
And that information has been out there. Dr. Andrews talks about it, Fleisig talks about it, Mike Reinhold talks about it. If you do year-round throwing, your increase of getting injured is 5 times higher than an individual that doesn't do that.
Right. So the thing is having that downtime. And everyone has to have that downtime, whether it's 3 months or I like 6 months. If they can go play another sport, go play another sport. But you have to have that downtime to decrease your risk of injury.
Maybe jump into that real quick, we're just touching, it's not necessarily related to weighted balls, but what are your thoughts on people playing different sports, not just playing baseball year-round?
Absolutely, because I think for a number of reasons. One, to again decrease your risk of injury because you're fatiguing the same muscles over a longer period of time. 2, it's just a cross training. And I think cross training is important that you're training different muscle groups to work in a coordinated effort, and all of that can help you in baseball, but not just the fact of you just playing baseball.
And there's been nice studies that have come out about looking at individuals that play different sports, and it actually has a protective effect on the injury standpoint and decreasing the percentage of injury.
Right. So I really, hit home with kids, hey, especially during the winter time, because everyone likes to play during the spring and into the summer, and I'm not a huge fan of fall ball. Go do something else. Go play soccer. I understand the risk of concussions and things like that in terms of playing football, But if you want to play football, go play football or go do something else. And then into the winter, hey, go wrestle, go play basketball. You know, go do those things. You can still do your exercises for your shoulder a little bit to get yourself ready, because those baseball kids, especially when they're younger, they're starting to get ready around late January, into February, trying to get ready for their spring season, which is reasonable. But you have to have that downtime, especially for a kid, because again, what you're looking at is underdeveloped bodies trying to put stress on underdeveloped bodies. So. Well, look, the big thing, again, controversy, but there is some science behind reasons to do weighted balls, but you have to wait. You have to weigh that with the safety and the other parts of the weighted ball program. So that's just one thing that we're talking about today. Hey, stay tuned tomorrow. We're going to talk about some other issues as it relates to our baseball athletes out here in sunny Surprise.